looking for a home in a prime location? Nesta's Home has got you covered. Our properties in Tema Community 26, just behind Palace Mall, offer a serene atmosphere, easy access to transportation routes, and social amenities. Off-plan prices start at $35,000 And contact us today for more information. These are the numbers to call: 053-101-4440 or 053-101-4447. Alternatively, you can visit our website at www.nestas.com.gh. Starting off with our big stories now, doctors at Tamale Teaching Hospital are on strike. Now, the group is protesting the dismissal of its CEO by Health Minister Kwabena Minta-Kando, and the doctors are saying that they have suspended all emergency and outpatient services. This is on our table right now to discuss. But first, we'll speak to our regional correspondent, Martina Bugri, to bring us some more details. Right. Ben, I understand we have Austin Game online with us.
And Austin Game is a labor consultant. He joins the conversation. Mr. Game, good morning.
Good morning, Benjamin and Tracy.
It's a pleasure having you join the conversation. We also have Dr. Kingsley Agyemang joining the conversation as well. Doc, let me just find out whether you can hear me. Dr. Kingsley Agyemang.
Yeah, good morning.
It's a pleasure having you join the conversation as well. I'll give you your proper designation in just a bit. But let me start with Austin Game. From the labor perspective, I don't want you to just address where we are now, but even before the spectacle we saw at the Tamale Teaching Hospital, how did it hit you from that perspective before we get to the current issue of the CEO having been sacked and the decision to stay at post from some perspective, and then the reaction of the Ghana Medical Association? What is your take on that?
Well, Benjamin, thank you, and good morning to my friend who is on the other side as well. To be honest with you, it has always been like that in Ghana, where labor and management have been somehow adversarial and a little trigger in any matter at all is taken to a different level. And because of the extreme partisan nature of our country, the slightest thing is developed into another kind of hype. And so, unfortunately, the minister, the gentleman, and ladies at the hospital in Tamale, there was a trigger and they went overboard, both sides. No one person commit all offenses. Me, I'm a conflict resolution person. And therefore, I do know that what I saw on the screen and my investigation behind the scenes clearly shows that there is a pent-up feeling already about lack of this, lack of that, coupled with the unfortunate incident at the hospital where somebody lost life, having drawn into the whole fray, and so created the many we saw. It was not the best on the side of both parties, and therefore it created an uproar and leading to where we are now, where everybody is jumping into it and creating further disturbance and disruption in the system.
So that is your initial analysis of the situation. Let me also bring in Dr. Kingsley Agyemang, a member of Parliament for Ebuakwa South and also a member of Parliament's Health Committee. Doc, thank you once more for joining the conversation. For you, I'm not asking us to get into the salient matters yet, but when you saw that video, what did it point to as a member of the Health Committee of Parliament?
Yeah, thank you, my brother. Very good morning to all your listeners. Warm good morning to my friend at the other side. As we indicated yesterday in our press release yesterday morning by this time, what we saw was no safety in a hospital. What we saw was very, very bad day for the Tamale Teaching Hospital. I mean, it's not something that is commendable. It was an eyesore. Not good, not the best for healthcare delivery. So we were very much worried, and that explains why we issued a press statement. It is the lowest point that you can get into public service, where the highly revered position of a minister is reduced to that of a wrestling ring with a healthcare giver in a hospital in the presence of patients. No. The office of a minister requires a high standard of sobriety, and it is very condemnable. We don't support it. It is a bad spectacle for healthcare delivery.
When you say you do not support it, you don't support the sacking of the CEO because it didn't follow due process, or you don't support the sacking at all?
So two issues here. The open confrontation of the minister with the neurologist and inappropriate manner, unconstitutional, administratively, and everything that has to do with the suspension of the CEO. These are the
Dr. Agyemang, we keep losing bits of your take. So can you start again? And maybe if you can reposition yourself.
Sorry, we got to Tamale last night as a minority to mediate this Tamale teaching hospital. Is it better now?
Yes.
Okay, so what I'm saying is that there are two issues here. One, the sacking of the CEO who did not follow due process has been made very clear in our statement. Then second, the open confrontation of the minister with the healthcare giver, the neurologist. So these are the issues. And that is where it has gotten us to where the teaching hospital is at this morning.
Before we get to what has happened, the fallout of it, what do you think should have been the ideal approach to handling this matter?
The law is very clear. I think Section 34 of the Ghana Health Services and Teaching Hospital Act is very clear. The minister does not have or is not clothed with the authority to sack. And if there is a need for a sack, it is the president that must consult the Council of State. And I don't think that has been done, or from what we know, that consultation has not been done. Secondly, I don't think you seated at Joy FM now, or wherever anybody works here in Ghana, if your regulator or your supervisor from Accra or anywhere comes to you and have an open confrontation with you, spit at you anyway, anyhow, it doesn't provide safety. We don't threaten people at the workplace. No matter how the day turns bad. That is why we are in the position of a minister. If NCA comes to your studios right now and begins to tell it at you or give it at you, is it something that provides safety? No. It shouldn't have happened in the first place. So that is why we are saying that the office of the minister calls for a higher sobriety. You need to be very, very well composed at all times, because that is how public service is like. That is how public service is. You meet things. And for the day, the doctor too might have been going through things. But we have to be more decorous. We have to calm down in all situations if we really want to stay in public office and at that high level.
Just a quick follow-up. You say the doctor maybe have been going through things. Can you ascribe the same, generosity to the sector minister, especially when there was the case of someone who had lost their life? Can you accord that same generosity to him, that he may also have been having a bad day, or that he was so infuriated by it that he acted the way he did? I'm just asking for your take on that.
I mean, in all humility, if it's a parent-child situation, who is supposed to exercise more calmness? I believe your listeners best judge. Why is somebody called a parent and another called a child? Why you called a minister? And why is he called a caregiver?
Do parents also lose it?
Sorry?
Do parents also lose it sometimes and do things they are not supposed to?
They do, but it must be lost in a more decorous way. Okay? That's the part that we are saying. It wasn't a good thing. Like my brother said, it wasn't a good thing. But you have come from the crack. Okay? You have come all the way from Accra to resolve something. So the hospital setting, things happen. We are not saying that the loss of that patient or something that can be underplayed. No, the loss of every soul is so important to a hospital. How do we manage it? Okay, how do we manage it? And if you seek to have an information on the death of a person, if the minister first clothed with that authority, you need to even have that information when patient information is supposed to be something that is confidential. Private. Unless you are compelled by the court or a security agency that is clothed with the authority of investigation. And how do you seek to have this through a confrontation? With the help of a hindsight, if this conversation had happened in conclave, we wouldn't have gotten to where we are now.
And Sweetie will come right back in. I do agree with you to a certain extent, because I've said that, I mean, for me, part of it, the spectacle was unnecessary. It could have been addressed in other ways. But if you look at the exchanges between them, I feel both parties could have also, done better. Back to you, Sweetie.
Yes, so now let's look at the demands you're making, and not you per se, the demands that the doctors are making, the apology, the equipment and all that, and how it is affecting people who the hospital was built for. The strike action is affecting people. Is it a concern to you at all?
Very well. It's very concerning. That is why the minority is here this morning to kind of have a discussion with the management of the hospital. We have a meeting with them at 9 o'clock, and we pray that they listen to us so that the good people of Tamale and the other 4 northern regions can have healthcare delivery. Because this is the only teaching hospital within the 5 northern regions. And like the saying goes, when 2 elephants fight, it is the grass that suffers. We don't want anybody from the northern region to suffer as a result of this strike. The minority, we are very much concerned, and that is why we are here. He appealed to our colleague. I mean, the demands of the Doctors Association and that of the GMA is no different from what we also issued out last morning. We believe that calmness must prevail in the interest of the people that we seek to serve. It cannot happen that this must continue. We plead with them, even as we get into meeting with them this morning, that, the profession is such that we save lives. They should put behind whatever has happened, as they always do, and give it their all, as they always do, to the people of Tamale and its surrounding areas.
Before I go back to Mr. Game, in your earlier submission, I get the impression that, the confrontation we saw was not with the CEO. So is the CEO has he been sacked because of that confrontation or because of what can be termed as irresponsibility on his part?
That's very interesting. They have not ascribed any reason to it. About all that we are saying.
Now, you gave some analogy about if someone comes to your NCA comes here and engages in open confrontation, etc.
The confrontation was with the neurologist, the doctor.
Great. So that's not the CEO, but he's the one who's been sacked. But you're saying that the confrontation is what you are, chastising, and that's what you do not support and all that.
We don't support the confrontation and the undue process the sacking of the CEO went through. And if your listeners remember, when I was on air with my colleague Suhini, he did indicate that the clash, the sacking of the CEO, it's not solely because of the clash. I think the minister also alluded to that when he spoke to when he spoke on your platform. All that we are saying is that the law is very clear. Whatever that might have happened, the law is very clear. If you even read further in the Act, it shows how disciplinary procedures must be handled. I believe that members of the political class or we in policy-making positions, we should endear ourselves to the various laws that we have enacted ourselves.
At what points does the CEO take responsibility for the issues? That's the point I'm trying to, get from you.
I mean, from a CEO perspective, you are responsible for everything that happens in your facility. But that does not mean that you can play God. I don't know if you get what I mean. So you need to be insulated at a certain point. That is why there are procedures, the administrative procedures that must happen in every facility. I don't think you having this meeting or this discussion with me now, the CEO of Multimedia, is even aware. But ultimately, he takes responsibility.
Right.
He is vicariously liable for everything that happens.
Mr. Agyemang, I want to understand if there are systems in place to evaluate performance of public hospital CEOs and if they were utilized here.
Supposed to be available, but we are not, Ghana is not, let me be very candid with you. Ghana is not a country where we set proper targets, where for people to work towards achieving objectives and applying strategies and so forth and so on. We don't do that. We pay people for coming to work, not because they have achieved any target. But having said so, I've listened to my friend, the Honorable Agyemang, and clearly I think that there is a problem that must be handled. Both parties went a little off course, but the reality is that a minister responsible for a sector is absolutely responsible for everything and reports to the president. And so it should be noted.
Are you saying that the minister is within his right to sack the CEO?
It's not about, the minister cannot do that without first taking authorization from his boss. That should be understood. I've been in the ministry before. And so clearly
who would be his boss in this context?
The boss is the president.
All right. I just wanted clarity. Go ahead.
Yes. And it should be clearly understood also that every CEO is responsible for even the most casual mistake of a person in any establishment. Even the most casual mistake of any person, the CEO is responsible. That is why you are called CEO and you accept it. So, I'm pleased that the minority is taking steps to ensure that things are done in a serene way. But we must do it professionally in a manner that is appropriate and helpful to the people who pay our monthly pay. The patients and the people in Tamale and Ghana in totality contributes to the paying of the monthly pay of the doctors and the minister and everybody else. And therefore, any action that is taken contrary to the rules and regulations of the country, it should not be accepted as normal. Now, the issue about sacking, the law is very clear that when an employer has the right, under Section 33 of the Labour Act of Ghana, when an employer has the right to dismiss a fellow, there is no option available. You can't even give notice. The person must be dismissed because you have the right to do so. If you don't have the right, you don't have the right. This is not about termination. It's not about suspension. It's not about punishment. It's about dismissal based upon certain understanding that the minister might have, which may not be open to all of us in the meantime. So
is there a difference? Is there a difference?
In this thing, after the confrontation, all of us, from a communication, labor relations communication point of view, it could have been handled in the best possible way. I agree with
Mr. Agyemang, is there a difference? Is there a difference? This dismissal and other things you speak of, because Kwabena Minta Akando, when he spoke that evening, made mention of the fact that the CEO had been relieved of his duties with immediate effect. And the question was put to him about what happens to the CEO then. And he made mention of the fact that he could be seconded to any other agency under the ministry. So what exactly do you mean by that?
If my reading in your media circles and from what I heard directly from them is anything to go by, my understanding is that the CEO has been dismissed. if he had been dismissed, and people are questioning the propriety of it, I'm saying that a dismissal is the highest offense at enterprise level, at enterprise level. And therefore, if the CEO is dismissed, it means the employer has the right to do so, and they did so. And that is the clarity. But it's not about anything else but dismissal. This is what we had. If it is about something else and we hear it, then we'll know where to place it.
Mr. Agyemang, are you saying that there's no system in place to insulate CEOs, or should I say leadership of state enterprises or like hospitals, for example, from political crossfires? And so once the minister decides that you've done something that warrants a sack, off you go?
No, there are several layers, even in our laws, not in just in labor relations and the Labor Act that we have. The regulation that goes with it clearly spells out how that minor offenses can be handled, middle level, or if you like medium type of offenses can be handled, and when it is a grievous offense that will warrant dismissal. A dismissal, you don't even have time to go into having committees and so forth and so on. Dismissal is dismissal. It's mentioned only once in the law, under Section 33 of the Labour Act. If you have leave, it is forfeited. You will not be given notice. You are dismissed forthwith, and that is it. But if it's just a minor or some level of offense that they can mutually part company with you, it's a different story. Comes under Section 15A. If it's about termination based upon incompetence, it comes under Section 62A. So clearly there are spelled out arrangements in the law, and best practices demands that we should do it that way. This is an altercation that should not have happened in the first place.
All right. So in this case, did the CEO, this is actions, a responsibility, all of it, did it warrant a dismissal?
A dismissal is the only thing that it means the employer has a right to undertake. And when it is done and you as a worker feel aggrieved, you can petition the superior of the minister, or you go to National Labour Commission, where the commission has the right to summon even the office of the president, not the president, because you can't summon a president.
Mr. Agyemang, in your expert opinion, right, in Labour, did the dismissal, is it justified? This is what I want to understand. This dismissal of the CEO of Tamale Teaching Hospital, based on your extensive experience.
All dismissals anywhere is, to start with, justified, because you cannot dismiss a person when you don't have the right to dismiss. That's why it is done without notice. Under the law and practice, you can dismiss without offering notice. That's why it is immediate. But when you feel aggrieved, you still have an option, an opening to go to the National Labour Commission, where it is an impartial body that can handle it. Okay,
let's take it from that angle, because I do remember the question was posed to the minister about, this bit, relieving him of his duties. And of course, like I said, he said it was with immediate effect. Was that the only option, punitive option available to the minister? You've spoken about what the Labour law says. My question then is, since dismissal is used so sparingly, was that the only option available, since you talk about minor offences, intermediate offences, and very high offences? What were the punitive measures available to the minister, if any?
Well, if you are going to terminate somebody, termination goes with a question of incompetence. And my understanding is that this is not about incompetence. From my investigation so far, I'm told it's not about incompetence on the part of the CEO. So it does not cover that. It is not about mutual separation under the law, Section 15A. That means the CEO feel, as a result of certain things, he wants to leave and they both mutually agree that they should part company. It's not about sue. It's not about a minor offense where he's being suspended as a measure of a deterrent or something of that sort. That is not the case. If they mention dismissal anywhere, what it means is that that officer that has the right to dismiss a person has the right and will not even give you notice. It means the offense is so grievous that there is no option open for it. It's a position that has been taken. That is it.
All right. So that was taken by the minister. You have to take leave of us. We'll let you do that shortly. But are there any breaches you see that could have been brought to bear on the part of the sector minister by way of the law? And he also mentions that the CEO can seek redress if he feels so guided to do so. What is your take on that? Just briefly, and we'll wrap it up with you. Austin Gami.
Oh, honestly, from where I sit in the reading of the whole episode, both parties in the outburst, in the open, I think could have been managed better.
Yes, but beyond the outburst and the real substance of the case.
Yeah, the substance of the matter is that the hospital is in lack of equipment, of especially ventilators, acute water shortage, which is not the immediate trigger. Somehow along the line, it appears to the minister that they could have been using some of the IDF, the internally generated funds, to manage some of the situations as far as they make requisition for the necessary tools that they need. Some consumables like gloves not warrant an attack on each other. It's most unfortunate that they have to open up in the public domain before the full glare of the media, and that escalated the whole thing. So I think that could have been handled, like I said, much better. And that way, I agree with Dr. Agyemang and any other person who is saying so. But I think that both parties should take lessons from it, bitter as the case may be, and that will not be repaired. And the gentleman who started and the lady who came in are not the subject matter now about either dismissal, suspension, or any form of action. So that should not be the matter that should immediately warrant a strike action, which is also inappropriate in any form or shape, because they are not supposed to take an action that way without giving proper notice. Immediate action is an affront to the law itself and best practice.
I am really sorry I have to do this. We have to get others on the line, but it just came to mind. This practice, and I'll get to Dr. Agyemang with it, this practice of politicians choosing the leadership of, these institutions, including the CEOs of our medical facilities and all of that, is this part of the problem?
You want me to provide an answer?
Yes, I do.
To be honest with you, as for health-related matters, it is national in character. So if you leave it solely in the hands of institutions, without somebody who is overall responsible for anything that can create an uproar in a whole nation, it's to be inappropriate to leave it solely in the hands of certain institutions.
All right.
So, except that they give authorization to, let's say, a board to interview and submit this things through certain systems to employ, fine.
Right.
Otherwise, the whole nation is directly under the care of the president of an executive presidency.
All right. Mr. Gami, we're grateful for your...
I just wanted to get one last bit before you go. I know you already said that every time you use a dismissal, it is justified. But in terms of the reasons that were given, Is that just cause? And if not, what options are available to the CEO? And then briefly, and then you go.
Oh, yes, several. He should apply to the National Labour Commission. I think that is where rather GMA comes in. GMA is a trade union in character, and therefore they protect the interests of their members. They should accompany the gentleman with a balanced written justification to the National Labour Commission, which is an impartial body to handle the matter and resolve it properly. Or if they have some relationship, that's why language usage is very important. They can also make an appeal to the minister. They can have a meeting and discuss how best they can relate. And if there is any option of tempering something with the CEO's dismissal and placing him where appropriate, all those things can be done. But I think that because of the immediate sour nature of the whole thing, they are not able to communicate properly. But I think that the minister is open to it. I'm sure GMA is open to it. But if not, they should go to the Labour Commission.
Right. Thank you so much. I think you missed my first angle, though, whether it's just cause or not. Can you give me a yes or no on that?
And normally, all dismissals under the law says in section 33 that you, the employer, must be right before you take any such action. So it's presumed to be justified. Right. And if the person who is visited on feels that the justification is inappropriate, he has options. Go to the National Labour Commission, appropriate place to go.
Thank you, Austin Game, for joining the conversation. He's a labor expert. He joined the conversation there. Some interesting messages, portions of the messages. So, Dr. Agyemang, I'm coming to you shortly. Just hold for me. Austin Game, we're grateful for your time. You can take leave of us now, sir. This message coming through says, the minister said he set up a committee to investigate and report to him in 2 weeks. Why can't the minister wait till the committee completes its work before any decision is taken? The manner in which the CEO was sacked was a rushed one. I've heard responses to that as well, justifying why the minister did, but I had to read that. This one says, just transfer all those doctors and we'll see who loses. Their private businesses will collapse just because of sharing the legal charges on patients, which is another aspect of the conversation where sometimes medical professionals have their own outfits or they make their referrals. That is what this person is pointing to. Nanaya Okwenu says, you sit in your comfort zones in Accra and seem to have every solution to every problem in Ghana, yet ordinary Ghanaians are suffering. Go to our polyclinics and see what is going on. Patients are not getting hospital beds and many dysfunctional equipment. There are pertinent issues around. So if you look at it, you would realize that people are mentioning other real problems on the ground. No one is saying the CEO is wrong or the minister is this or that. But in the end, Minister Cole, CEO Cole, how do we resolve the problems? And I'm coming to you, Dr. Agyemang, on that. You're an administrator. When these medical doctors, whatever position they rise to, take the Hippocratic oath, they actually take that oath to preserve life, respect patients, and all of that. Preserve life. Looking at some of the dynamics you know in the Tamale Teaching Hospital, I'll ask you, do you feel politics is part of the problem that we are facing? Dr. Agyemang, that question was for you, sir.
Yes. Before I come to that, can you hear me?
I can hear you.
Before I come to that, the labor expert, Mr. Austin, made some submission that I want to address quickly. The establishment of the teaching hospital or the Ghana Health Services is guided by its Establishment Act, particular reference to 37(1) that all members of the board will be appointed by the president in consultation with the Council of State. If we refer that to the fore, that is where they are saying that if there should be termination, the president must do so in consultation with the Council of State. This is where we are saying that has not happened. Did you get it? That's why we are saying that it did not follow due process. We are not saying the president does not have the right, or if his right was delegated to a sector minister to do so. But we are saying that due process was not followed. Now, political access.
So walk us through what due process would be.
The due process by the Act says that the president should do so in consultation with the Council of State, which has not happened. Okay, has not happened. The last time we had a discussion on this yesterday morning with the member of Tamale, Honorable Suhini, he attributed what has happened to coincidence, the sacking of the CEO. So the Council of State has not consulted, or the President has not consulted with the Council of State. That is established. That's why we are saying that due process was not followed. Now, back to your question, political actors, we have a very huge role to play. I mean, healthcare delivery, healthcare financing, doctors and other people within the health fraternity who are approved. But there's an absolute power invested in the administrators or the executive to provide the necessary things that will make their work very good for them. So we are saying that they are challenged. Every health system is challenged. We don't have a health system anywhere in the world that does not have challenges. Peculiarly to Tamale Teaching Hospital, water is a very huge issue. Electricity. And almost every facility that appeared before the Parliamentary Select Committee for the year 2025, this year, before the budget was passed, all of them had issues, not directly related to health. You mentioned their IGF is using the IGF. Do you know that their IGF is capped? The IGF is capped. The non-mechanization of several staff, because they need them. They employ these casual workers who are not mechanized, and they pay it out of their IGF. So all we are saying is that based on the Abuja Declaration, which directs all member states to spend 15% of their budget, annual budget on health, we must try to get to that level. Because this 2025 budget is only 9%, health represents just 9% of the national budget. So a lot of resources need to get to the health facilities for the delivery of health. And even before they get that, we have to have discussions on a more network interaction. As for the tank and the heart we have, they're not going to take from anywhere. So we are saying that let's talk, let's discuss, let's find a midpoint. Because truth be told, healthcare givers go through a lot in a day.
I think I get your point. Sweetie will come in shortly because we have to have other interactions as well. But the point I was trying to make, should we have an administrative setup where these appointments are made devoid of political entanglements? That is what I'm trying to find out.
It is because it has a board that has institutional representation. Okay, so and the Council of State is not political. I don't even know how. I mean, Council of State is not political. That is why the framers of the law said that the president, who is political, should consult the non-political actors, who is the Council of State.
Well, let's bring in. Thank you, Dr. Agyemang. Please stay with us. Don't go yet, Doctor.
No, I have to. You know, the meeting is at 9.
Okay, so Dr. Makuri Nawani is online with us. So just in a minute, we will let you go. So he is a chairman of the Health Committee of Parliament. Doc, thank you for joining the conversation. And I'm sure you've been following the conversation to this point. What do you make of everything that's coming in so far?
Thank you very much. Let me say good morning to the viewers of Joy TV and say that what the nation is going through now is unfortunate. It is a situation where we must have cool heads. There is a period that when you are angry or you move from the rational to the irrational. But after some time, you recover. And so both sides at this stage, I believe that they are in the recovery process. And we can sit down and talk And then all decisions that have been taken, there's a period that you can turn them around and then decide, yes. What is the next thing?
Right. As
there
chairman
is no
of
need crying over spilled milk, yeah.
Dr. Market Nawani, as chairman of the Health Committee of Parliament, what is your strategy here? Because patients' lives are in danger if doctors do not return back to the hospitals. What's your strategy to ameliorate the situation?
Yes, at this stage, the Health Committee, as a body, we want to be part of the solution of this impasse. And I know that if they continue or the process continues, it might even get to our doorstep, where as one of the ways of getting the solution, the speaker can be petitioned. When the speaker is petitioned, you definitely refer it to the Health Committee. And so we don't want to take sides so much on some of these issues for now. We are appealing to the Ghana Medical Association, and we are appealing to the workers at the Tamale Teaching Hospital to take a second look at their decision, because they are like this party, I know, yes, but they have to take into consideration the type of work that they have agreed to do. I've been practicing for 32 years as a medical practitioner, and strike action will be something of a last resort.
Dr. Nawani.
And not necessarily the immediate tool to try to get things done.
Dr. Nawani, you speak of industrial actions being a last resort. I made mention of the Hippocratic Oath a short while ago. So there are the requirements on medical professionals, including the medical doctors. But how about the minister, the sector minister as well? I've heard you say you don't want to apportion blame, but do you feel the actions so far have been justified in terms of relieving the CEO of his position, which has led to this, reaction from them who say they will not undertake certain critical services?
I've had the opportunity to work with the current minister as his deputy ranking for, I think, for a period of about 4 years. And he is somebody who I must say that before he takes decisions on such or going around, we need to go around as the minority health team. He does a lot of homework, and he takes his time to really draw up a plan of movement. What happened at the Tamale Teaching Hospital? Like I'm saying, it appears that something went overboard. And as a professional, I'm not also very enthused about what happened. But I believe that...
Are you saying the minister went overboard? Is that what you're saying?
It's not the minister. It takes two to tangle. Remember that you look at the way they started. Look at the way things appear to be going well, and look at the final outcome. Because whenever we go around, currently, yesterday I was at the Burghouse Regional Hospital, doing some rounds over there. In fact, we wanted to come out as a committee with some of these issues that are lacking at the various hospitals. And to even call the Minister of Health and his senior managers to a meeting so that we can discuss these issues at the hospital. It is normal to hold or to converse with the people who are working, who are at post. Whenever I entered a ward, I spoke with the nurses there. It is normal to do that, yes. And it is also normal to even speak to patients who are around the facility, just to get a first-hand information of what is happening. Yes. So what he was doing was not necessarily wrong, but like I'm saying that something happened.
Okay, yes. Just clarity on this.
The outcome has not been as probably we expect, or as probably I know my minister very well would have wished that it ended. I don't think he is also happy that it ended that way.
Right. I don't think the intention with his going there and the member of parliament, I don't think either one of them would have wanted it to get to where it did. So I can understand from the minister and the MP's end and from the CEO and the health professionals' end. But just quickly on this point, though, do you think due process has been followed in all of this? Because even where there are egregious, actions that deserve punishment, due process must be followed. Was due process followed? You have over 30 years of experience in this. Was due process followed?
In my opinion, it appears two things are being mixed up. But it happened that, like I'm saying, that it did not end as was expected. The issue with the CEO and the on-the-ground inspection and trying to get first-hand information. And people are now being mixed up. Like they came in, and then because of what happened, the CEO has been his appointment has been terminated.
I think the
Yes.
minister clarified that. He spoke.
I'm thinking that two things are being mixed up here.
No, the minister spoke and he clarified that. He said that it wasn't on the back of that interaction and that there had been precedents that had already been in the fray, but then upon that as well, certain actions had to be taken. So I think that one is clear for us. I was only asking about those actions specifically and whether due process is being followed in all of it, because we've been told about where this must go to, what committee must sit and review this and that. In fact, the minister himself spoke about a committee reviewing for about 2 weeks. That's what we're addressing, not that instance per se. But from where you sit, just moving forward, what should we expect so that the people of Tamale and its surrounding communities can receive health care without interruption? What should we expect?
Yeah, there are two issues that probably we need to consider. One aspect is the town of Tamale itself, the problems that exist, and how the hospital can be insulated from the problems that are there. If you talk of the water, if you talk of the electricity, etc., these are issues that are in Tamale, and then they need to find a way of insulating the hospital from these problems.
All right.
Then comes the internal problems of the hospital. And I must say that yesterday when I was at the Border Regional Hospital, I did not mince words to say that, look, back in Canada and other countries, before you take over the administration of a hospital these days, you are supposed to have an MBA with specialization in healthcare management. You are supposed to be thinking of how to make money. Whenever I speak like this, they tell me that they are supposed to be providing services and not making money. But the two things are necessary. And we know that the charges that are there, and we know what the patients and then the NHIA are paying. And we can compare. as we move from one hospital to the other. And we know that, no, this hospital, their IGF is on the lower side. And so we expect that they should be orientated well. People who are running hospitals should be orientated well.
Right. Okay.
Yes, to take good care of their money and use their money to help solve the internal problem.
All right. Dr. Market Nawani, thank you for joining us. He's Chairman, Health Committee of Parliament. And because the situation concerns the people in Tamale, we want to take you live there. Martina Bugri is on grounds for us and wants to show us the situation as we speak this morning. Martina, if you can hear me, take it away.
Good morning. I'm currently at the Tamale Teaching Hospital, and you can see in the background, people have come this morning from far and near to attend to the hospital. But as we speak now, there's no doctor around. What I was told earlier on with my engagement with some authorities, I was told that the hospital is holding an emergency meeting this morning with the doctors to try to work out something so that people can have access to health care this morning. As we speak now, those who have come early, I spoke to someone, she said she came from far, and she came as early as 6 o'clock. It's almost 9, and they are yet to receive treatment. Most people who have come in, those who can afford or who can look for substitutes, others have left. But as we speak now, yes, we have long queues here, but no doctor available yet.
What about nurses? Are they helping out?
Yes, so the nurses are attending to the patients, the necessary procedures that they are supposed to go through before they can see the doctors, they are being done. You come to the OPD, people go there, they pick their cards, they come, either their weight, their temperature and vitals are taken. But they are directed to sit at where normally you would sit and go into the consulting room to see a doctor. And so after those procedures, they come and they line up at the place designated for consulting with the doctor. So as we speak now, most people go through and they end up at that point. At that point, there's no one yet to receive them.
Martina, patients who have come to the hospital, did they know that the doctors are on strike, or they came oblivious of the fact that there's industrial action ongoing?
Most of them did not know that there was a strike action declared. Some got here and got to know that, yes, there's a strike action. Some also said they heard it, but they were hoping that the decision would have changed by the time they get here this morning. And so that's what's happening now at the Tamale Teaching Hospital.
Beyond that, I mean, what have been the reactions? I know some of the people may not have been aware of what was going to happen, but what's the general sentiment there, at least from those who are coming to seek medical attention?
Much as they appreciate that the doctors have an issue, they were also hoping that at least for humanity's sake, they would attend to them once they understand that they have a pledge to take care of patients when the need arises. They are hoping that at least they will come to a compromise with the management, and then they will begin work as soon as possible. Now, I have also been trying to speak to the doctors group, and I'm told that currently what they are doing is their national body has taken over communication. Any communication concerning the group in Tamale here would have to be directed to
Martina Bugri there, doing us the honors from the northern region, the Tamale Teaching Hospital, to be specific. And we're grateful. I think we get the thrust of everything she's had to say so far.
No casualties.
Hopefully not.
No casualties will be recorded. Hopefully. We can only keep our fingers crossed and hope that the doctors return to post. That takes us on a quick break. When we return, more action on the Ben and Sweetie Show.